All the lies about diabetes. Diabetes, like any common disease, is actively discussed by patients and is surrounded by myths about the causes, course of the disease, and its treatment. These misconceptions, most of them concern nutrition, unfortunately, are very persistent and are widespread not only among patients, but also among some doctors. Let's look at the most popular myths about diabetes and debunk them. Diabetes, like any common disease, is actively discussed by patients and is surrounded by myths about the causes, course of the disease, and its treatment. These misconceptions, most of them concern nutrition, unfortunately, are very persistent and are widespread not only among patients, but also among some doctors. I will look at the most popular myths about diabetes and debunk them. Myth 1. Diabetes develops from excessive sugar consumption. Of course, excessive sugar consumption is harmful to health, leading to obesity, but it is not the cause of the development of either type 1 or type 2 diabetes. Type 1 diabetes is a disease of the immune system, corrected by the introduction of insulin. Type 2 diabetes is a genetically determined disease that develops against the background of obesity. Myth 2. Buckwheat and kefir are very useful for diabetes. It was believed that if you grind buckwheat and pour it into a glass of kefir, then the sugar level decreases. Let's dismantle this myth. Buckwheat groats are products rich in complex carbohydrates and do not lower, but moderately increase blood sugar, like any other crumbly porridge, millet, pearl barley, rice. Kefir is a dairy product containing milk sugar, lactose, therefore, it also increases blood glucose levels. Kefir and buckwheat are sources of carbohydrates necessary in our diet. But their consumption in diabetes should be reasonably limited, because they, like any carbohydrates, increase blood sugar levels. Myth 3. Fructose, grape and cane sugars increase blood glucose slightly. Fructose and other natural sugars are also sugar. But they do not belong to hexoses, like glucose, but to riboses, pentoses. In the body, it quickly turns into glucose through a biochemical reaction called the pentose shunt. Unfortunately, very often the so-called products for diabetics, sweets, are prepared precisely on these types of sugars and mislead patients about their safety in terms of increasing blood glucose levels. Myth 4. Honey is allowed for diabetics. Honey consists of fructose and glucose in approximately equal proportions and increases blood sugar in the same way as regular sugar. Myth 5. With diabetes, you need to limit carbohydrates as much as possible. Carbohydrates are the basis of nutrition, they should make up to 60% of the diet, and there is no need to limit them with diabetes. But preference should be given to complex carbohydrates, cereals, vegetables, bread, pasta. With type 1 diabetes, if it is under good control, you can also eat simple carbohydrates, sugar, confectionery. Nutrition for this type of diabetes is practically no different from normal. With type 2 diabetes, you should give up simple carbohydrates, as well as exclude animal fats and monitor the calorie content of food. Myth 6. I eat very little, but I am gaining weight. This is not from food, but from hormonal imbalances/pills/insulin. Food is the only source of energy in our body. Excess weight does not come from thin air. Against the background of some diseases and taking some medications, fatty tissue accumulates more intensively, but it is formed only from the food eaten. Myth 7. You can't eat after 6 o'clock in the evening. It is possible and even necessary if you feel very hungry. If you stop eating more than 5 to 6 hours before going to bed at night, this will lead to nighttime drops in blood sugar levels, morning weakness, and eventually to fatty liver disease. Myth 8. Blood glucose should always be determined only on an empty stomach. To assess the compensation of diabetes and the correctness of hypoglycemic therapy, it is important to monitor glucose levels in different modes. This depends on the treatment regimen. With intensified insulin therapy, monitoring should be carried out before each meal in order to adjust the dose of insulin administered with food and before bedtime. When taking tablet hypoglycemic agents, monitoring can be carried out less often, but not only on an empty stomach, but also 2 hours after eating. Myth 9. White bread increases blood sugar more than black bread and crisp bread. Black bread, white bread, and crisp bread increase blood sugar in any case. But rich bread increases blood sugar more, and bread with added bran or whole grains, less than regular bread. The amount of any bread should be moderate, no more than 1 piece per meal. Myth 10. Unsweetened, green, apples are acceptable for diabetics, but sweet ones are not. The taste of an apple depends on the content of organic acids, and the sugar content depends on the degree of ripeness, not on the color. It is essential to eat apples in your diet, any you like, but no more than 1 piece per day. Myth 11. You cannot completely exclude sugar from your diet, because glucose is needed for the brain. The brain does consume glucose, but not the one we eat as sugar, but the one that is in the blood. Myth 12. Diabetes is an exclusively hereditary disease. Unfortunately, this is not true. With type 1 diabetes, heredity is 5 to 10%. With type 2, lifestyle and diet play a decisive role. Myth 13. People with diabetes should not drive a car. If we are talking about a well-compensated and properly controlled course of diabetes, when the risk of hypoglycemia while driving is low, then people with diabetes do not pose any danger to themselves or others while driving. Myth 14. People with diabetes should not exercise. Exercise is beneficial for people with diabetes who are in a state of good compensation and regularly monitor their glycemia levels, and who know how to change their diet or change the dose of insulin before a planned workout. If the sugar level is over 13 mol/L, exercise is not recommended due to the possible paradoxical situation with an even greater increase in blood sugar levels. Myth 15. All people with diabetes will sooner or later go blind and lose their legs. Loss of vision and amputation of the lower extremities are formidable vascular complications of diabetes that can be prevented by good control of glucose, cholesterol, and blood pressure using modern therapy. Myth 16. Women with diabetes cannot have children. With proper preparation for pregnancy, patients with well-compensated diabetes under the supervision of experienced doctors, endocrinologist and obstetrician, carry and give birth to healthy babies without harm to their health. If you are concerned about questions to which you receive too contradictory or too frightening answers on the internet, contact your endocrinologist. He will definitely give you the right answer and teach you how to act correctly in a given situation. I will tell you about a unique, very simple but effective method of treating diabetes mellitus types 1 and 2 in one of the following lectures. This method was used by the Jews in ancient times and was described in the clinical diaries of my ancestors.